It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of my clients, and the question last week was part 3 of my sister is in intensive care on a balloon pump and ventilated after cardiac surgery. The doctors want to stop treatment against our wishes and let her die. What should we do? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer the next question from one of my clients, Emma, which are excerpts from one-on-one phone and email counseling and consulting sessions with me. And the question this week is part 4 of my sister is in intensive care on a balloon pump and ventilated after cardiac surgery. The ICU doctors want to stop treatment against our wishes and let her die. What should we do? And that's part 4. You can also access part 1, part 2 and part 3 by clicking on the links below this video. And if you are watching this on YouTube, just click on the link below this video and it'll get you to our website where you can access all the other episodes and more other free resources. So in the last counseling and consulting session with Emma, we were discussing how Emma can keep her sister alive on life support, even though the ICU doctors were adamant to stop treatment, remove life support, and let her sister die against her and her family's wishes. In today's one-on-one phone consulting and advocacy session with me, we look into how Emma can further change the dynamics into her and her family's favor without feeling intimidated by the intensive care team. I'm going to share many gold nuggets in how to use simple strategies in order to get things her sister's way. So you can look up the dialogue between Emma and myself below this video and you can read it. And then I continue here with some email dialogues between me and Emma, and I'm just going to read them out for you. So, hi Emma, further to our phone call, I share some links with you that clearly highlights that physicians in Texas in the USA cannot override the wishes of patients and their families to withdraw life-sustaining treatment. And again, I'll put some links in the written article below this video in the written blog. Use this information to your advantage and position your sister's situation appropriately. So then Emma responds, hi Patrick, I also attempted to get the nurse to allow me to call you on today, allowing you to speak with her. The nurse stated for me to try later as she had to leave my sister's bedside for some type of skills, and that another nurse that was not as familiar with my sister's care would cover for her for the time she would be gone. I asked her if I could call and conference the call with you later in the day. She seemed very hesitant. I'm not sure what's going on. It seems like the nurse, manager and staff are uneasy with my presence. While I was visiting with my sister today, ethics and the doctor rounded. They asked me if I had any questions. I informed them that I was simply listening. The doctor made the statement that they're trying to strengthen my sister's heart, and the nurse manager made the statement that my sister has been weaned down to only 3 blood pressure medications, also known as inotropes or vasopressors, and that was a good thing. I just listened to each of them speak. I have requested to view my sister's hospital records. The manager of the unit said that upon signing the consent to release records, that she would have to be present in order for me to view my sister's records while she's in the hospital. Please, can you tell me what is the role of ethics? The ethics keep asking me how I feel, and I have explained to them that I'm not happy with the care that my sister has received at the hospital. Many thanks from Emma. So here's my response to that. Hi Emma, nice to talk to you a moment ago. quick summary of what we discussed. Keep taking one day at a time and aim for getting your sister through the weekend. Keep ignoring ethics. Please keep in mind, is it ethical wanting to withdraw treatment against your and your family's wishes and in essence kill your sister? Keep asking for copies of the medical records with a deadline. Take it as a compliment that they feel uneasy in your presence. They are not used to being questioned and they feel resistant. Continue to focus in your communications with them only about what you want and expect. Keep repeating whenever necessary, and that includes getting me on the phone with them. It's just a matter, you need to change your expectations. And if you change your expectations, everything else will follow and change. So, questions going forward. Number 1, when did your sister last have an ultrasound or an echocardiogram of the heart? Number 2, what is her current ejection fraction, also known as EF? Number 3, what blood pressure medications is she on? Commonly used blood pressure medications, also known as inotropes or vasopressors, are norepinephrine or noradrenaline, epinephrine or adrenaline, dobutamine, dopamine, milrinone, and levosimendan, also vasopressin. Next, what sedation is your sister on currently that's keeping her in the induced coma? It's very likely your sister is either on propofol, which is also known as Diprivan, or on midazolam, also known as Versed, for sedation, and on morphine or fentanyl for pain relief. If you can find out what medication she's on, it would help tremendously. I'm looking forward to hear from you soon. Keep staying strong and stay positive. So, here's Emma's response. Hi, Patrick. We are grateful to God that my sister is still alive today. She's still intubated on the ventilator. The nurse says that the breathing machine is at 4D. She's on dobutamine of 5, vasopressin 0.04, and norepinephrine 5. The nurse says that they are attempting to wean her from the norepinephrine. She was on 8 yesterday and earlier today 5. And the last I heard was that they weaned the norepinephrine to 4. They decreased the fentanyl from 50 to 25 and the propofol is on 50. They increased her tube feeds to 45. Please can you tell me what all of this means? The nurse also told me that she had her last echo or ultrasound on September the 4th and her ejection fraction was 50 to 54. Also, the doctors have not called for another family meeting at this time. They haven't really said anything. I have been attempting to avoid them during rounds. Today they called me out of my sister's room and asked if I had any questions. I told them no. The doctor stated that my sister's heart is weak and that they will try and extubate her when they have weaned her off the heart medications. My sister is able to open her eyes and nod yes or shake no and respond on command. Please help me to understand. Here is my response. Hi Emma. Just to quickly summarize our phone conversation. Number 1, it's good to hear that they're trying to wean the inotropes and the vasopressors down. It's a sign that your sister's heart is getting stronger slowly. The ejection fraction 50 to 55% is okay. However, keep in mind this is with the support of the inotropes and the vasopressors like dobutamine, norepinephrine, epinephrine, and vasopressin. Ideally, ejection fraction is greater than 50%, but without the inotropes and the vasopressors, because that would be a sign your sister's heart is working without life support. Dobutamine is increasing the contractility, also known as the pump function of the heart, whereas norepinephrine and vasopressin are squeezing the blood vessels to have more blood available close to the heart to pump through the body. Reducing fentanyl and propofol is very good. The lower the sedation, the better, so your sister can come out of the induced coma. The more awake your sister is, the higher the chances she can come off the ventilator. Before she can come off the ventilator and have the breathing tube removed, they need to have a plan what they do if she can't breathe by herself. Please also send me the pictures of the ventilator and the bedside monitor So I can see if your sister is close to being extubated and if it's realistic that she can be extubated. Next, please make sure you stay positive throughout all of this. You are the most important person in all of this, and you need to stay positive and sane. Don't let your emotions overwhelm you. Emotions are important and they are a healthy sign. However, you need to use them strategically and whenever they serve you. There will be plenty of time to be more emotional after you've been through this and potentially saved your sister's life. Next, take time out when you need to. Your sister and your family will need you at your best. You are the most important person in all of this. Make sure you get enough sleep, rest, fresh air, and drink plenty of water. You've gone a long way and you need to give yourself a pat on your back for being so strong and for having given your sister a second chance at life. Next, do not and never take any prisoners and don't let them take you for a ride. Moreover, keep displaying good and strong body language. Head up, shoulders out, and maintain strong eye contact with the doctors and the nurses. 99% of the families of critically ill patients in intensive care are intimidated by the intensive care team and they can't even look them in the eye, and they also show by their negative body language that they feel intimidated. Next, brace yourself for some setbacks. Recovery in intensive care is often 2 steps forward and 1 step back. Do not give up if it happens and stay positive. Please send me a picture of the ventilator and the monitor and I will advise you of the next steps or questions to ask. Anything you need in the meantime, please let me know. Look out for part 5 of the next one-on-one counseling and consulting and advocacy session with Emma in the next few days, and I'll see you then. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision-making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence quickly in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I will see you again next week in another update. Make sure you will also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype, over the phone or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.